Good afternoon, everyone. My name is Marla McGinnis, and I will be your moderator for today's news conference. Before we begin, I'd like to introduce Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Dr. Strang.
Thanks, Marla. Good afternoon, everybody. Are there more people on the line? All right, okay. All right. So thanks for coming on a Friday afternoon. I think it's important that, and I'll get into it in a minute, that we wanted to have a discussion about our case numbers and what they mean and how we're interpreting them. And so today we are reporting 123 new cases reported from the lab, and that's an important distinction. Normally, the cases we report have been had an initial investigation and by public health information on that investigation around all the factors we look at, personal information and contacts and things has been collected and entered into our information system, Panorama, and then we pull our cases from Panorama. Because of the volume of cases, we now have a backlog of cases having that detailed investigation. So for the next few days, for the foreseeable future, while we deal with getting top of the backlog again, which we've had before and we've dealt with it, where it's more accurate that we give you the number of cases coming from the lab. So 123 today. The breakdown is 56 in Central Zone, 60 in Eastern Zone, 6 in Northern Zone, and 1 in Western Zone. We don't have any more information because that's all we get from the lab. A couple of things on that. I also want to add that, so those are new cases today. The cumulative number of cases for the Sainovex outbreak, we've had 55 new cases reported, and these are ones that have been investigated by public health that we know are attributed to the Sainovex outbreak. So our total number of cases in the Sainovex outbreak is 114. A couple of things about the numbers. We know, as we're looking into things, that many of the cases, the new cases in Central Zone, are quite likely part of the Sainovex outbreak for two reasons. Some of the cases we have been able to investigate are people who live in Central Zone but were at the X-Ring events the last weekend. We also know that if there's a student who maybe lives in Halifax or their parents' home is in Wolfville or somewhere else, but if they're attending Sainovex, based on their health card number, the address that they will be given will be their home address. So as we are able to do the investigation, we're uncovering these and seeing that more and more, even though they're attributed to Central Zone under our kind of how the breakdown of information happens, they're actually we're at and a part of the Sainovex cluster and may well live up there. So I think just to understand that the number of the cases that are in other zones other than Eastern Zone are likely to be part of the cluster of cases at Sainovex. Even though there's a backlog of cases, we're still, our primary objective for public health is always that a new case, once we get it from the public health gets it from the lab, that there's an initial contact made with that case within 24 hours. And we are still making that first contact. But what we're doing is then getting just basic information and then prioritizing those cases. And we're making it a priority now. What I've asked people to focus on mostly, we want to make sure we don't miss or are slow in picking up cases that may be secondary spread elsewhere as a result of an exposure to someone who's part of the Sainovex cluster. So the priority for the more detailed follow-up is cases that aren't clearly linked with Sainovex. So I'll use an example. If we have become aware of somebody who's a student at Sainovex and living off campus in a household with 5 other people, 2 of them are already known as cases, that's fairly straightforward, and that goes as a lower priority for more detailed follow-up than somebody, maybe a case is down in Bridgewater or say even in Halifax, and we're not sure, and we want to make sure that we have a better understanding of those cases where they may have been exposed in the circumstances of those cases. But what we're doing in all cases with that initial call within 24 hours, every case is given information around their need to isolate, information on what to watch for of worsening illness. And we're also now asking people to, while we're waiting because of some of the backlog, to start to identify and contact anybody they may have been in close contact. So those people, and we're giving people information about how to do that and what to say. It's important that we get people doing that and not waiting for the more detailed public health follow-up to start that process. The other change we're making is because of the circumstances of what we're seeing in the Sinovex outbreak and the number of cases. We are now asking that anybody who is a contact, anybody who's been identified as a close contact, so you would have heard, whether you hear from somebody who themselves is a case and calls you up or texts you and says, I now have COVID and when you and I were together and so you're a close contact, or you may hear from public health by email, text, or a phone call, or we have high-risk exposure notices, a number of those, restaurants and other places, especially in the Antigonish area. So if anybody is in those circumstances, we're now going to be asking those people, regardless of vaccination status, that they need to isolate, and then at least 72 hours after their exposure, make an appointment and do a PCR test. And we need them to wait at least those 3 days, and then do a PCR test. If their test is negative, then they can come out of isolation. Previously, because of the protection of vaccine, in the last few months, we've been saying people who are fully vaccinated, even if they're exposed, don't need to isolate. Because of the pattern of what we're seeing of fairly easy transmission and lots of transmission of people in cases who are fully vaccinated, we're going back to what we used to do and say, regardless of vaccination status, people who are identified as contacts need to isolate and do that PCR test. Has to be a PCR test through one of our assessment centers at least 72 hours after their exposure. That's just another layer of precaution because of what we're seeing. Fortunately, what we are seeing, even though we're seeing a significant number of cases, and be honest, expect to see more cases in these type of numbers in the days ahead. We're probably getting to close to or at the peak of our cases, and then then we should start to see things start to again decrease. It's a bell curve, like any outbreak. We go up and then we come down, and we're probably close to that peak or getting close to the peak or at the peak. But the next few days are going to have much higher case numbers, and people should be aware of that, not taken by too alarmed when they see that. But fortunately, because I think this is an important point, that we're seeing the protective effect of vaccines. All the cases we have now are relatively mild illness. It's a flu-like illness. It's not comfortable. A lot of kids are sick, fever, chills, malaise, but we're not seeing any impacts, people not having to go to emergency rooms, not having to be hospitalized. And I think that's attributable to, this is in a younger age group by and large, but also the majority of these people are vaccinated, at least a single dose, many of them with 2 doses of vaccine. That doesn't mean the vaccines aren't working. It shows the protective effect of the vaccines, especially against severe illness. And if we look at the hundreds, if not upwards of 2,000 people who were exposed, the fact that we now have 115 cases actually shows you that there's still a very good protection there has been a good protection from the vaccine. Which leads me to the next point, is really about for the general public. We should take this as a bit of an alert for us. It shows us that the things that we have in place continue to be important, and we need to hang on to them, starting with vaccine. So it's really important that people who are unvaccinated get vaccinated. There's about 5% of our population, our adult population out there, who haven't been vaccinated. You're vulnerable, and because of your vulnerability, you're making other people vulnerable. So it's important that they get vaccinated. It's important that we continue to have really good uptake in the vaccine for the 5 to 11-year-olds. We need to get a high level of vaccine uptake in that age group as well as an important additional layer of protection for themselves. We can't just assume that COVID-19 is going to be mild just because they're young kids. There are serious implications for COVID-19 for young kids. Plus, having them protected helps protect all the rest of us. We now have booster doses out for, we announced today now people who are 60 and above can make an appointment now to get their vaccine. Adding the 60 to 69-year-olds is new today. But it's really important that people in these age groups, the older you are, the more vulnerable you are because of waning immunity and just underlying age, a less robust immune system, and more likely having chronic conditions. So it's really important that people 16 and above, if they haven't already done so, make an appointment, get your booster dose. If you meet the criteria for moderately to severely immune compromised, whether it's based on a health condition or medications you're on, and the list of those criteria is on our coronavirus website. If you haven't already done so, make an appointment and to get your third dose of vaccine. If you're moderately to severely immune compromised, you're at increased risk and you need a third dose of vaccine in your primary series. And again, you will, as we said the other day, you will be eligible for a booster dose, but that won't be until the spring. And then we've now got vaccine available for all frontline healthcare workers, including those in community like dentists, physiotherapists. Previously, it was just for frontline healthcare workers who had less than 28 days between their first 2 doses. Now, because of their increased risk of exposure, all frontline healthcare workers are eligible to get a booster dose of vaccine. So all those groups, it's really important that we maximize uptake of whether it's primary series, especially in the young kids, or third dose for immune compromised, booster doses for age or healthcare workers. And I'll end by saying all the information I went through at the briefing the other day, that we need to get through the holidays safely. COVID is still around us. What's happening in St. FX is a stark reminder of that. So we can't be too relaxed. We need to all continue to practice. That's why we still have the proof of vaccination in place. It's why we're requiring indoor masking in indoor public places, and we are looking at ways about how we strengthen compliance with that masking. But all of us, the choices we make, the number of social events we go to, the number of people we have in our close social circle, those are all things that we need to be very cognizant of. I used the expression the other day about it's time, this holiday we're not nearly as restricted as we were this time last year, but it's still, we need to be careful and cautious. Now is the time to slow down our contacts with others. Choices about how many social events we have, choices about how widely and how frequently we travel. All of those are things that we all need to make thoughtful and careful choices on to keep ourselves safe and to decrease the chance of contributing to the spread of the virus.
Thank you, Dr. Strang. Okay, we'll start with questions in the room before we move to the phone. Go ahead.
This outbreak is one of the largest, I think, and recently anyway. Have you thought about asking for travel bans in and out of Antigonish as HRM did a while back, or should there be further public health measures taken?
We're not. I don't believe at this point that's necessary. We're in a different place now than we were even the third wave, where we still were building our vaccine coverage. We now have very good vaccine coverage, which is a layer of protection. But also looking at the dynamics of what we're seeing mostly is people that were exposed last weekend. We're not seeing signs of significant secondary, third level cases. We will see some of those, but I think the vaccine is very protective. So I think it would be premature to add on other measures like that at this point in time.
I noticed on the potential exposure advisories that went out last night, a handful of them were for late November in Antigonish, November 30th, November 29th, well before the X-ring ceremony. Do you have an understanding of how the virus entered the community?
We don't. That's part. Clearly it was brought. In all likelihood, it was brought there by people coming into Antigonish for that weekend. Remember, when we do an exposure notification, it's when somebody became symptomatic and 48 hours before that. We did have some virus, so some people traveling around. Clearly, it was there at some level, whether it was there in the community or brought in just before those events. But there was people that could have been there for a few days before that weekend.
In a few days, if not a week or more, they'll be finished exams at St. FX and dispersing across the country for the holidays. Are there any concerns? Are you hearing from any of your equivalent chief medical health officers from the other jurisdictions a concern about this spreading out across the country from this one event?
Well, we were always concerned about that, and we have the same concerns from events elsewhere in other provinces. It's always a reality of domestic travel. We've had a couple of cases in PEI now, and I believe there's been a couple of cases of who traveled back to Ontario. We are working with the university to really, we want kids, young people who are part of the student population, to stay there, to get through their exam period. If they were exposed last weekend, they're already halfway through. It's another 7 days and they're through their full 14 days. And we know that from last weekend, the majority of people who were exposed and were going to become infected would have become infected already. And there's lots of people getting asymptomatic testing and picking up on that as well. So we're working to try to understand where people are at, and if people are still in their isolation period, when their exam ends, they're going to have to stay where they're at until they finish that isolation period.
The possibility that some of these trips home for Christmas will have to be canceled or postponed?
We're working with the university, but yeah, if there's a student, who becomes infected now and is still in their 14-day isolation period, we're going to have to support them. And they're going to have to delay their travel until they can be. We're not going to let somebody travel who is still in their infectious period.
Does St. Martha's and the other healthcare facilities in the area have the capacity to handle this?
I was on calls with them and other community leaders yesterday, along with the minister. They have a contingency plan, but and additional resources will be brought in as necessary. It is a relatively small hospital, but I think we're right now, as I said, we've had no more severe levels of illness that require emergency room visits and hospitalizations. Again, for two factors: the younger population, but also the significant benefit of especially mRNA vaccines are very protective against severe illness.
I noticed that the high schools in Antigonish have had cases connected to them. It's been suggested to me that there were student teachers from the university who were still going to the schools after the outbreak was discovered. Why haven't you just closed those schools, or what's going on there?
So there were a couple of student placements, though those have now stopped. Student teachers from St. FX education program are no longer doing that. We would close a school if it was necessary. We're treating these schools like we treat all other schools. There's no ongoing greater risk to those schools than there would be in other places when there's some spread in the community. So we will monitor those schools, and if necessary, based on the criteria we had, add enhanced measures or close the schools. But we're not going to do that just out of precaution. They're not directly linked with what's going on, which is really in the university-age students.
For the last couple of months, there's been no updates over the weekend. Given the volatility of this situation, has there been any consideration given of restoring the weekend updates so that people can track this more precisely?
No, we're going to be giving an update again on Monday. I think we need to. We'll be monitoring things very closely, but I think we need to have people focus less on the daily case count and more about what is the pattern of cases we're seeing, more even on a weekly basis. Because I think that case count feeds into a lot of unnecessary fear and anxiety. But we will be watching it carefully, and if there's a need to make any notification over the weekend, we would certainly be talking to the public about that. But we will also be making sure that there is a robust update on Monday.
We're
Why?
going to jump to the phone lines. I'll come back to the room. We'll start with Keith Doucette with the Canadian Press. Go ahead, Keith.
Hi, Dr. Strang. I think earlier in the week when you said that the focus had been on certain off-campus events as a potential spreader. I wonder what the investigation has shown, given that a lot of people were actually vaccinated and a lot of the on-campus events were said to have followed protocols. Does that actually make a difference now? Can you still say with certainty that it didn't happen in the campus sanctioned events? Where are we with that?
So there's a couple of events that we've information has been passed along to our enforcement and compliance team, as well as discussion with the university and our compliance team around a couple of larger off-campus parties that would by initial appearance would have exceeded the 25. So those are under active investigation by the enforcement folks and working with the university. I don't think any of those have reached any conclusion. I don't have any update today on those, other than I know the enforcement is actively involved.
Follow-up question?
Yeah, but I was wondering about the actual university-sanctioned events on campus. There were several large ones held there. Can you say with any certainty that despite, I mean, you can ask for proof of vaccination at the door all you want, but if people go in and take their masks off and they're carrying it, it's going to spread, right? So can you rule that out?
Those are a couple of the events that we've got some evidence that videos and things that a lot of people are aware of that we've handed those over and people are looking at that. I will say, and this is what I said, we're looking at clarifying and tightening up some of the rules around masking. Masking at seated events, it's very clear, but when there are people and there's often drinks or maybe food available and people are up circulating around with a drink in their hand. If people are actively eating and drinking, they are allowed to be without a mask. So that's why it's not as clear cut as you might initially think, whether there actually has been non-compliance with masking rules or not. But though that is actively being investigated.
We'll move now to Sarah Plowman with CTV. Go ahead, Sarah.
Hi, Dr. Strang. Speaking with people in the community here in Antigonish, people are saying to me they believe the university, in their words, quote, dropped the ball. Can you respond to that based on what you've learned? And I know you were just asked about the investigation, but...
So I don't have any evidence that I would say that anybody's at fault to blame. We're looking at things from an enforcement perspective. The reality is that we have a virus that is very easily transmittable. And unfortunately, and we've got certain rules around the size of gatherings and how gatherings are conducted. And my understanding is, the requirements of numbers were met. Certainly in formal events, proof of vaccination. There's a gray zone around masking or not that is being looked at. I'm much more interested in trying to, find blame. I'm much more interested in trying to move forward and deal with the outbreak than try to spend a lot of time trying to find blame for what was or was not done. However, we are, as I said, we do have the enforcement folks doing their job looking into that.
Sarah, do you have a follow-up question?
Yeah, you mentioned some videos previously, and you mentioned the gray area around masking. Have you seen videos or photos of the events on campus that showed that people were mingling without masks on campus at these sanctioned events?
So two of the videos I've seen fit into that gray zone, and people are able to have drinks in their hand up walking. So it's actually what I've seen myself. It's not clear cut whether there was non-compliance or not. And so that's why we're looking at how we tighten that up and make it clearer what's allowed without a mask and what's allowed and what requires a mask. So there's much less of this gray zone moving forward.
Okay, we'll move to Elizabeth McMillan with CBC. Go ahead, Elizabeth.
Dr. Strang, I'm wondering what, if any, supports are available for students in Antigonish who are sick and far from family, and if there are any resources for students who maybe live with roommates, maybe they've tested negative, but they're living in very close proximity to people who've tested positive.
So that's a better question for folks on the ground. I do know that there's a lot of work between the local health community, the community in general, and the university, making sure that there's good supports for people that are sick or they're in isolation for other reasons. Antigonish did a wonderful job back in September when we had students who had to quarantine for 2 weeks, providing them with food, etc. You'd have to talk to people much closer on the ground about details, but I do know that those robust supports are in place in the community.
Elizabeth, do you have a follow-up question?
Yes, thanks. I was also wondering, is there advice for students who may have been exposed, may have tested negative? Should they be isolating if they're heading home from the holidays in the next few days?
So, I mean, what we're looking for people, if they have had been at one of the exposure sites or have been notified by public health, then they need to isolate and until they've had a negative test, a negative PCR test, at least 72 hours after their exposure. If in general they're just doing rapid testing because we encourage people to be doing ongoing regular rapid testing, even if they haven't had an exposure. So I would encourage students, even those who may not have had a known exposure, been identified as a contact, before they travel home, in the day or two before they travel home, there's lots of access to a rapid test kit. Do a rapid test kit in the day or so before they travel home.
Okay, we'll go to Paul Bacon now with All Nova Scotia. Go ahead, Paul.
Dr. Strang, you mentioned the ease of transmission in this particular outbreak. Will our labs be able to tell if this is the Omicron variant or not?
As we said earlier, our labs directly can't, but we're doing some initial assessment of specimens, and then those that are concerning from a lab perspective will then be sent on to the national lab. To date, we have not had any definitive identification of Omicron, but we can still continue to submit specimens, and I'm certainly not ruling that out as a possibility.
Paul, do you have a follow-up question?
No, thank you.
Okay, we'll go to Aaron Beswick with the Chronicle Herald. Go ahead, Aaron.
Hello, Dr. Strang. St. FX continued sending student teachers and student nurses to schools and health care facilities in the Antigonish area until Wednesday. And today we have 3 schools, Dr. John U. Gillis, St. Andrew's Junior School, and also the school in Guysborough have sent out exposure notifications. Was public health aware of this, and could this continuing to send student teachers and student nurses out into the community have contributed, and should it not have stopped earlier? Right? So, the outbreak was becoming aware of it on Monday.
So I think we only became aware really of the outbreak on Monday and Monday into Tuesday, the extent of it, and by Wednesday things were closed down. So I think the closing down, those appropriate steps were done in a very timely manner. It takes some time for an outbreak investigation to unfold.
Aaron, do you have a follow-up question?
I do. We're hearing a very different tone from you and from the Premier regarding St. FX than we did about the Baptist Church in Amherst. And St. FX did bring, they had a gathering of 2,000 people. We've had a much larger outbreak than we had with regards to the Baptist Church in Amherst, and I've heard from the religious community in Cumberland County that they feel that they were targeted because they were a marginalized community. How do you respond to that?
So my response is that at St. FX, we're still investigating whether there was or was not noncompliance, and if there is clear evidence, we will take appropriate enforcement action. The church in Amherst was a very different situation. It was very clear that there was noncompliance with existing requirements around proof of vaccination, and so I see them as 2 very different circumstances. We're not treating them differently. Where we have a clear evidence of non-compliance under the public health order, we will take appropriate enforcement action regardless of the population involved.
Okay, we'll go now to Drake Lauthers with the Port Hawkesbury Reporter. Go ahead, Drake.
I know you spoke on that you're still investigating the non-compliance, but in your opinion, should the events on campus like the X-Ring, Super Sub, and the Fall Convocation happen this past weekend?
Well, in general, events of that size are allowed as long as they follow proof of vaccination and follow the masking requirements. I think what we're investigating is, and as I've talked about already today, that whether masking requirements were followed, and that is especially in standing events when people are moving around but may also be eating or drinking, that there is some grayness in that we are working actively now with sector colleagues to tighten that up. But again, that we allow large gatherings under proof of vaccination and masking requirements. So, you know, there's nothing fundamentally that you could say that St. FX was doing, holding these events that were against what's allowed under the public health order.
Drake, do you have a follow-up question?
Yes, I do. And was there a reason why public health didn't contact owners of one of the businesses in Antigonish before they were placed on the advisory list? Because they had to find out through one of their clients.
That's a level of detail that I'm not involved in, a level of investigation. I can't comment on that.
Okay, we'll move now to Lindsay Armstrong with the Coast. Go ahead, Lindsay.
Thank you. Dr. Strang, you've talked about this gray area with mask wearing and strengthening and clarifying rules. I'm wondering when can we expect that change?
We're looking at that. We're going to be having some conversations early next week with, with folks who do large events, as folks as well as, restaurants, bars, and nightclubs, and get their perspective on it and on how do we actually make it clearer and on when masks are required and not, and make it clear on who's responsible then for requiring masks to be worn when they should be masked. So we understand that the urgent need for that, and we're going to be actively looking at. We've already had conversations today, and we'll be following up those conversations early next week.
Lindsay, do you have a follow-up question?
Yes, thank you very much. And I'm wondering, Dr. Strang, if you've assessed broadly how many of the St. FX COVID tests still have to be processed and what the testing uptake has been generally in the Antigonish community.
So there's no backlog in testing, unlike when if you remember back in the third wave, it was a backlog in the lab. The backlog we're talking about today is public health's capacity to do the detailed follow-up. Everybody is getting who's a case comes in with it, comes in once public health receives it. Everybody is getting an initial contact within 24 hours. It's the more detailed follow-up which is taking some more time because of the volume of cases. So that's why I've said we're making sure that initial contact people are getting information for themselves, and also how they then go about doing their own contact tracing and giving people contacts to then isolate, and not waiting for public health to then you get to the contacts, and we're also prioritizing the sequencing and the timing of who gets that more detailed follow-up. And as I've said, it's a priority to get those where it's not as clear that there's a link with St. FX. We really need to make sure that we're identifying any possible spread beyond the initial St. FX cluster, and so they need that urgent, more detailed follow-up.
Okay, and we'll go next to Lois Ann Dort with the Guysborough Journal. Go ahead, Lois Ann.
Oh, thank you. I wanted to talk about the school in Guysborough situation here. Every day I see 3 buses leave from our school and that go past my house. And today, of 3 school buses that should have been full, in total there were 8 kids. Most of the elementary school has been exposed, and quite a few in the middle and high school. There were hardly any kids at the school today at all. So my question about that is, shouldn't we just move to online school?
So that's an education decision. Public health has clear criteria based on COVID and the number of cases, the number of potential exposures, and any evidence of transmission within the school that we would then use to make a recommendation of closing down a school. Closing the school or moving to online learning for other reasons is an operational decision by the education system.
Lois Ann, do you have a follow-up question?
Yes, I do. As a majority of, to my knowledge, the students in the elementary school, which are unvaccinated due to their age, are on test, there will be concern here because ER is scheduled to be closed from the 14th to the 18th next week. Is there anything that Nova Scotia Health can do to, work to facilitate getting locums into this hospital at this time when we may be facing an outbreak?
That's the first I'm made aware of that. I don't control those kind of operational issues. That's really a question for Nova Scotia Health Authority.
Okay, and finally we'll go to Ken Kingston with News 989 XFM in Antigonish. Go ahead, Ken.
Thank you very much. We've been hearing a lot of concern ourselves the past couple of days with people concerned that perhaps we may be headed for lockdown. But based on what you were telling us earlier there, Dr. Strang, you see the infections probably reaching their peak and going down. So that's probably not something that's being considered right now?
I do not at all see that we're at a point where we'd have to significantly tighten down restrictions. I'll never rule that out. We'd always use that, but I think we're in a very different situation with this fourth wave, even with Omicron and the inevitability that sooner or later it will be here in Nova Scotia. We got vaccines, and we have very high uptake of vaccines in Nova Scotia, and so as I've said all along. Our objective is to keep where we're at with very good vaccine, building the coverage with booster doses, third doses, sticking with proof of vaccination, mandatory indoor masking. I believe, unless there's something very unusual, that level of measures will get us through the next, through the holiday season, through the winter. But always we will reserve the need to tighten things down if necessary. But again, why this is different now than even the third wave is because of our vaccines. I can't say that strongly enough. And what it does point out that why people who are not fully vaccinated need to get fully vaccinated to even strengthen our layer of protection, and why those who are eligible for booster doses or immune compromised with a third dose need to get that additional doses of vaccine. We're in a place now where we now need to focus as much about any case of COVID. And we really need to pay more attention to, are we seeing severe illness? Vaccine allows us to be way more tolerant of spread of COVID as long as it's not spreading enough or in the populations where we're getting significant amounts of severe illness. So far in this Saint-Evex outbreak, we are seeing relatively mild illness with no pressures on our healthcare system. And vaccines are an important part of that. So we'll continue to take that perspective. It's more about watching closely the severe illness, limiting spread, but not getting too concerned about any number of cases we're getting in any one particular day. It's the trends, especially the severity of illness that we're seeing, that we're paying more attention to.
And do you have a follow-up question?
Yeah, I do. Just kind of curious because we've had the mobile testing clinics. They had it for a couple of days, and they've extended it for this weekend at Saint-Evex University. So I take by that there's been quite a huge take-up in testing now with all these infections that have been detected here because of Saint-Evex.
Absolutely, that's exactly what we want to happen. And the fact that I'll go make the point that we picked this outbreak up very early, simply because, especially students themselves, were choosing to go get the self-test. And then we were getting a lot of reports of positive rapid tests that we then needed to go get confirmatory tests through the PCR. And that initial signal was what we then started to look in and started to investigate with the university. So it shows our testing strategy, and having people taking good advantage of regular use of rapid tests helps us pick things up early. And the fact that we've picked it up early and putting all the additional measures in place also gives me the confidence that we will get through this, and get through this in a relatively, I believe, in a relatively short period of time. But I can't say that with 100% certainty, but we do have the right things in place and the strong advantage of putting them in place very early on.
Are there any final questions in the room before we wrap?
I'm wondering if the modeling suggests that we're going to see hospitalizations related to this outbreak.
We haven't done any modeling of this particularly. In the population that's mostly involved, the risk of severe illness, even without vaccination, is low, and the risk of severe illness with vaccination is extremely low.
I just wanted to ask about the numbers for this outbreak. Are those numbers just those people with Nova Scotia health cards? The reason I ask is because a number of St. FX students would be here from out of province. Where would their, if any of them are infected, where would their numbers show up? In these numbers or in their home province?
No, they'll be, if they're here as students, they'll be part of our numbers. It's different. If there were parents that were here and then have gone back, like to Ontario, then they would be part of Ontario numbers. But if they're here as students, so the 115 cases we know of so far is people associated, whether they're from another province. But if they're here for the university term, the semester, then they're part of our Nova Scotia numbers.
You mentioned PEI. Have you heard of any other places that have?
My understanding is there's 1 or 2 cases in PEI, and I believe Ontario has 2 cases that people who were here for last week and then traveled back.
And just very quickly, you said many of the Central Zone cases are actually connected to Antigonish. Before this outbreak, there was ongoing about 20 a day in the Central Zone. Do you have any insight into what's happening in the Central Zone for those numbers?
No, we're still seeing, we've got a school in the Beatville, Timberley area that's closed down, so we're still seeing, around, some transmission, mostly in the 5 to 11-year-olds. Because we haven't done the detailed investigation, I can't tell you exactly how many of the significant increased cases in Central Zone today and yesterday are attributed to St. FX. We'll get that over time as we do the more detailed investigation. But when you do, even when you look at preliminary, look at the age group, all of a sudden we've got a lot more people who are in the 20 to 24-year age group, right? So I think we're still seeing the ongoing pattern of transmission mostly in 5 to 11-year-olds. On top of that, now we have all this older age groups with likely who were exposed as part of the St. FX outbreak.
Great, thank you very much. That concludes today's news conference. Have a safe weekend.
Thank you, sir.